Joint treatment at this point. Shot, we're going to get into these SI joints. We're going to destroy the pain nerve on both sides. Shot. This is a little bit more difficult procedure. Jordan, you're straight on. I think I want to enter. Shot. I want to line up my metal probe that you guys are seeing perfectly. I think right. Shot. Yeah, I think right. Yeah, right there. Go ahead. We're going to make a 4mm incision through this small little cut. I'm going to go in with my probe and destroy the pain nerves to the SI joint. That should take away her SI joint pain. Any questions, Shot?
No questions.
Shot? All right. Let's show the audience how sacroiliac joint pain comes about through an injury to the actual SI joint. Shot?
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. Shot, you can see from our video that the SI joint can become damaged, and once it's damaged, it gets arthritis in it. Like many joints in our bodies that get damaged over time, they develop arthritis. Shot. And turns out there are these pain nerves that run deep in the joint here. And that's what we're targeting with our rhizotomy. Shot. These pain nerves. If we successful at getting them all, then this SI joint pain that she has will literally go away. They actually come out of these holes in the back of the SI joint. Shot. They run off to the side and innervate the joint itself. And if you can get all 5 of them, which you can't see them, but you only kind of know where they are based on the x-ray, then you can get rid of the SI joint pain. And that's what we're trying to do for her. Shot? All right. Yeah, she has a very immediately projecting hip bone, huh, Jordan? Shot? That makes it a lot harder for me to do this. Yeah. Yes. What are you saying? Yes. Oh, no, I'm just looking at her bony anatomy. I think probably shunt here would be a good entry point. Let's do that. We've got the right SI joint now. In a minute. Let me just see what I can do with this. Shot. 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 Yeah. She's got some unusual bony anatomy. Let's get another tip. And it's sort of blocking access to the top of her SI joint here. But I'm going to try to work around it to get down there and do what we need to do. Shot. Shot. Yeah. Shot. That might be better there. Shot. That's getting a little better right there. Shot. That's about the top of the deep part of the joint. Shot. A lot of it is just feel. You have to feel the surface of the sacrum. Shot. It's not easy to do. Show them the joint over there, Jordan, on the SI joint. Can you guys see the SI joint?
Yes, we can.
Shot. Yeah, she has unfortunately some weird anatomy where the bone is coming really medial, kind of blocking access to the joint. But I did the best I can do. Let's just hope that's good enough for her. I've not had a failure yet. We've done probably over 500 of these procedures.